channel. It is on when is today? Times are running so fast, and even sometimes Thursday. Oh yeah. Wow. Thursday, man. On Thursday, we're still talking about. We have deviated now. We are doing some other things now. We are doing some cancers. We are doing some cancers, and check on this. Welcome, my friends. I'm just coming in, and Uncle is already here. Uncle Onik. Onik, Uncle Onik is in the house. Onik goes low, gets lost, and then he comes back. Onik, what's up? What's up, Onik? What's up? Yeah. Okay. How are you? Onik, I'm fine. Onik, I'm fine. You go lost and you come back. And you come back. Hope you are doing good wherever you are. Welcome everyone who is in the channel, everyone who is here, everyone who is watching Dr. Benjamin. Just for you tuning in, don't forget to like what you are seeing. If you feel it's good, like, man, like. Hit the like button. Hit the like button. Let me see you liking. Let's get impressions. Liking gives impressions to more people to come and watch. So welcome. Today we are continuing with the topics that we do are medical topics. If you are a new person to the house, tell me where you are watching from. Aristopat, morning doctor, I'm here. Aristopat, even Doc is here. Aristopat, how is where you are? Aristopat, which side are you at? That one should be you are in the US. Welcome, Aristopat. Please welcome. I thank everyone who is tuning in. If you are new, please tell us you are new to the channel. Let's see you telling us I'm watching you from the US, I'm watching you from Uganda, Kenya, US. Aristopat, US, nice. Thank you for tuning in. Everyone who is watching, this is Dr. Benjamin. Yes, Dr. Benjamin. And thank you for coming in. Please don't go without subscribing. Subscribe. We should be at 2,000 right now. Subscribe to the channel and stay around. Talk to Onik at the chat. Say, Onik, hi, how is Armenia? Let's interact at the chat. The chat. When you start talking at the chat, you can find some good friends. The connection. You can find some good friends. The connection at the chat. So hit the chat. Tell us where you are watching from, as we welcome everyone. Today I can see men are the first one. Men are the first ones to come to the chat. Men are the first. I can see Jamaican Uncle. I can see Aristopat. I can see Onik. Thank you for tuning in, everyone. We want to talk about how to prevent some cervical cancers, how to prevent some diseases that come in, and like cancers, like cancer. So as we welcome everyone, please today don't go without liking and subscribing. All the new people, like and subscribe. We have been talking a lot of very many topics. We have been talking about hypertension. We have been talking about several issues, and people have liked it. People are embracing it. People are coming up for Benjamin the Wise Guy channel. People are embracing the channel. So if you are watching, give me a topic that you really need. Which one? The topic that you feel we should continue doing. Eh? We were created first in the Garden of Eden by God. Yes, very true. Very true. Very true. We were the first created in the Garden of Eden. So, Aristopat, welcome. And today we want to talk about prevention of bad diseases like cancer. How can we prevent those diseases? How can we stay away from those diseases? So, let's welcome the new guys in the channel. If you are new, don't feel afraid. Text in my channel, tell me that we are watching you from the US, we are watching you from Asia, we are watching you from this country, and we will embrace everything, and we will welcome you to the chat. We will welcome you to the chat, and we will link up with you. If you have a channel, tell us I have a channel. We boost you by watching your channel and commenting in your channel. So every person who is new, I can see many people coming in and going out. Don't just scroll away. Don't just scroll away. One day you'll think, oh, I saw Dr. Ben somewhere talking about this. And then you'll start finding, having a hard time finding my channel. Just subscribe. Subscribe to the channel. Let's increase the subscription. Subscribe to the channel, and if you are watching for the first time, tell us where you are watching from. Tell us where you are watching from. Give me your likes, man. If you are there watching me, I'm Dr. Ben. Joa Bastia, from Brazil. We have one of the new people from Brazil, Jamaican uncle. I like new friends. Now we have a new friend called Joao Batista. I only knew of Batista of wrestling. Now I have a friend called Joao Batista. Hello, Dr. Benjamin, and everyone in the house. My wife is in the chat. It's called Beatrice. Beatrice is saying hi to everyone. Baby girl is in the chat. Jamaican uncle, you see? Yeah, Beatrice in the chat. Now, Joao Batista, welcome. Batista, welcome to the chat. Welcome to this topic. We are talking about medical issues. Joab, hope you have subscribed. A new friend, a new subscription, new like to the channel. Let's increase the likes. Let's continue growing and growing everywhere. One day I was watching, I was live with my daughter, and a classmate texted telling me, show the child's face. I didn't know it was the classmate. So the classmate said, I know her. We are in the same school. Let's increase the social, the social friendship. You see. So welcome everyone. We want to talk about how to prevent cancers. We don't like cancers. Cancer is a bad thing. So we want to talk about how to prevent cervical cancers and cancers of other cancers. All of them starts from somewhere. Most of the cancer starts from epithelial cells. Most of the cancer start from epithelial cells. So we want to see how we can. Yes, please continue giving me those likes. They are coming. The likes are coming, and I'm seeing them dropping. But the problem is, some people are coming and they are going away. Don't go away. Don't go away. Don't go away. Welcome, my friends. Welcome everyone here. Welcome to the channel. Greetings to you, Batista. I'm waiting to start. I'm waiting to start how to prevent cancers. You have seen there are some two things that cannot be treated by drugs. They can only be suppressed. One is let me take this one. One is viral infection and the other one is cancer. Treating cancer is becoming a problem. Has been a problem since so long. The other thing is virus. When a virus gets into you, it becomes a big problem. So, treating those two things, we are Judy J. Kingray is in the house. Judy, welcome, welcome. At least the first lady in the house is Judy today. Judy, welcome, welcome to the chat. Thanks for everything. Oh, not the first, the second lady. My wife was the first. My wife, my wife was the first one. Then Judy. I'm fine, Judy. I want to talk about cancers. I was saying there are two things in the field of medicine that are very complicated. One is a virus. Treating a virus is not possible. You can only suppress it or stop the generation from going on. The other thing is cancer. Those two things are very complicated. So the only thing we can do, it is how can we prevent these two things? How can we prevent these two things from happening? How? Anyone who knows, let's bring the points down. Let's bring the points here. Let's talk about it. I've heard some people saying there is a treatment for HIV/AIDS, and I've heard some people saying, I think that one, let me put it as a poll. Let me put it, where is this poll? Yes, this one. Have you ever seen someone is healed of Yes, that is the question. Let me start the poll. Let me see how many people have ever had. Because it's a virus, it's supposed to be suppressed. Have you ever had someone has been treated and cured HIV/AIDS? But right about now, we want to talk about suppression of cancer, how to avoid getting cancer. Let's talk about how to avoid getting cancer. Cancers are very bad. Cancers are very bad, and they can make you, they can destroy you. And you have seen so many people have gone because of cancer. Because of cancer. So I'm seeing people have some people have said no. Okay. Some people have gone with because of cancer. So for us to stop this dilemma and all these things, we should know how to avoid cancers, how to get this problem. We should know how to avoid to get this kind of problems. They are not good. Now, what is cancer first? What is cancer? If you are watching me where you are, what do you understand by the term cancer? If you are watching me right about now, tell me what you understand by the term cancer. Because you should understand something before you go to another thing. You should understand something before you go to another thing. So, what is cancer? Cancer is a form of mutation. Cancer is not a single disease. It is not a single disease, but a group of diseases which of some blood cells grow and divide uncontrollably. You have cells that are growing uncontrollably, cells that are just growing and growing uncontrollably. These abnormal cells can invade nearby tissues and sometimes spread to the other parts of the body or the lymphatic system. That is what cancer is. You know, it starts from the DNA because the cells multiply from the DNA. You remember the process of meiosis and mitosis. So meiosis happens to fertility cells, the other ones somatic cells, which are the body cells. You see, so cancer is a very huge topic, but there is one thing we can do. I heard that everyone has it in their body, but it's not active. Is that true? No, uncle, that is not true. No, that is not true. What is true is you have some immunity markers. You have some cells in your body that helps you to continuously stop the body from getting it. If this, like cells like tumor necrotic factors and some cytokines like P54, if these cells are having a problem, you will definitely get. You remember what we talked about, breast cancer gene 1 and breast cancer gene 2. Those are the kind of cells that help you to stop having cancer. Breast cancer gene 1 and breast cancer gene 2. I can see most people are in the chat. Please welcome and tell us where you're watching from. If you are new to the channel, tell us where you are watching from. We like new guys in the chat. So come to the chat, tell us where you're watching from. Today we are talking about how to avoid getting cancers. We like friends, so don't forget to. Okay, thanks for verifying for me. Thanks, Jamaican uncle, and everyone who is watching. Please don't forget to like the video, the live, and don't forget to subscribe. Don't just watch. Subscribe to the channel. You may get so many more information in this channel that is helpful. Very good information. And not information only, good friends. Come to the chat, tell us, hi, I'm watching you from this state, I'm watching you from this state. Yes, very important. Now let's continue to talk about cancer. How to prevent. So cancer is a group of diseases that develop and they become what? A problem to treat, because cancer starts in the DNA of the cell. Inside your body, inside the cells, they mutate. They start forming cancer cells. So what do you think is happening to people with cancers? Containing it needs to do what? Containing it needs to be removed or suppressed. Needs the cancer cell to be suppressed. You see, the cancer cell to be suppressed, not to continue doing what? Growing in your body. Now, we have talked about cancer a lot of times. I know everyone, if you go to my videos and the lives that I've done, you'll see some types of cancers. But let's talk about today how to avoid. I can see a new guy. Good evening. I'm from Brazil. Tati Moreira. Tati, hi. Welcome to the channel. Hope you have subscribed to the channel. Tati, how is Brazil? Please look around and see if you don't connect with someone, and please do if you did not. Yes, if you have a channel, please tell people to support you. They will really support you. Here we support each other. So I can see Tati Moeria. How is Brazil, Tati? We have Batista from Brazil too. Batista from Brazil. Hope you are doing good from Brazil, Tati Moeria. Hope you have subscribed and you are liking what you are listening to. And if you have a question, please ask. Welcome to this channel. Welcome. And let's grow together. So if you have anything, we are having a poll that is going on, and it's asking if have you ever heard someone is healed of HIV/AIDS? There are some people who say that there are some what time is it there? Is it 11 or 1? Here it is 5 or 1 p.m. in the evening. That is, I'm in Africa, Kenya, and it is 5 or 2 in the evening. Hope you are doing good. Is it 11 p.m. or 11 a.m.? 30, where you are? Is it 11 p.m. or 11 a.m. where you are? Hope it is 11 p.m. or what? Okay. Welcome, Tati. Hope you have subscribed to the channel, and you can go through my playlist and see what we do and everything that we do here in this channel. You know, we do so many things that are good for us and everyone, and everyone who is here in this platform. So if you have a question, don't fail to hesitate. Any medical question, bring it, we discuss. So we've seen cancer cells are multiple group of diseases that matter and bring problems to a person. So there is no guarantee way to prevent all cancers because they start in very different ways. You saw at cervical cancer, you saw in cervical cancer, HPV virus can bring it. Several issues can bring cervical cancers, several issues. And now I'm starting by saying there is no guarantee on prevention, but there are some ways you can prevent to get the cancer itself. You see, like cervical cancer prevention, you should get vaccinated against HPV with the HPV vaccine if eligible. If eligible. You see, what is HPV vaccine? What is human? HPV vaccine is human papilloma virus vaccine. Protects against infections with HPV. And this one is for women, not men. Men, you don't have cervical cervix, but you know, yesterday as we were talking, you saw a man can pass the cancer to a woman. So causes most cervical and other cancers are. There are some other causes of cervical cancer, but this one, HPV, is the most leading one. It's the most leading one. You know, it destroys the cells at the cervix, and then they mutate. You start having problems. Now, let's talk about something that is very important. What is this that is very important? Attend regular cervical screening. You attend regular cervical screening. Go to the hospital. Yesterday we talked about cervical screening. We talked about pap smear and Viavil. You remember? Visual inspection with Lugol iodine and acetone. Visual inspection with acetone and visual inspection with Lugol. For a woman, if there is histories of cervical cancer in your area or your home, if there are histories of cervical cancers around where you are, what should you do? Visit a facility and ask them. If you've been spotting every time with pain, a lady, every time after menses, after 2 weeks, you see spotting, and there is pain, and there is no direct infection that is giving you, or you're just feeling pain, it is important to visit a facility and you do what? I know someone who gives vaccine to their son. Can that cause a problem for him? It depends with which vaccine the son is getting. Which vaccine is it, uncle? You know, vaccines are many. We have vaccines against polio, we have pertussis, we have cholera, we have vaccines on yellow fever, HPV, the one we are talking about. So it depends with which vaccine the son is getting. Even people get vaccines when they are traveling. Yellow fever vaccine. Yes, there is no problem to get a vaccine if you are eligible to get a vaccine. It is important to get a vaccine so that you don't be exposed to these diseases. You don't be exposed to these diseases. Oh, I know someone who gives vaccine to their son that can cause no, it can't cause problems. It can't. It is okay. It can't cause problems. It is okay. The vaccine of HPV, maybe it's giving the son that vaccine so that the HPV virus cannot harm the son, which is okay. So Everyone who is watching, welcome to the program. Welcome to the chat. Welcome to the platform. If you are new, blessings, Dr. Ben and the chat. Welcome, Chat Travels. Welcome to the platform. Thank you for tuning in, and welcome so much, Big Sis, for this discussion. The third lady to come in the platform, Chat Travels. The third lady to come in the platform. Today, ladies are hiding. Ladies are hiding, but no big deal. Remember to like, and if you are new, subscribe to the channel. Let's talk about preventing cancers. Preventing this thing that is called cervical cancer. Let's prevent it. Yes, let's prevent it by getting the vaccine, HPV vaccine. Let's prevent it by getting HPV vaccine. So I can see more people coming in. If you are watching, Dr. Benjamin Maje, welcome Maje. I smile when I see Chat Travels and Maje coming along. yes. If you are a new person, subscribe. Here we have positive people that talk about good things, and you will meet good friends here. Just come at the chat and tell them, hi, I'm from Nigeria, I'm from Brazil, I'm from Kenya. Interact and you'll get good friends at my chat. So thank you so much for tuning in, everyone. Thank you so much for coming in as we talk about cervical cancer. Cervical cancer is a very important topic. So let's talk about cervical cancer, my friends. What is cervical cancer? There are some things that bring it, like HPV virus. HPV virus brings cervical cancers. And this is a matter of concern. You've seen so many women losing their wombs because of cancer. Many women going down because of cancer. I can see the poll is going on. Now, I'm very curious. I'm a curious boy. If you have said yes, someone has been healed by HIV, please come and tell us how it happened. Please come. I have a reason why that poll is there. Please come and tell us how it happened, and we will thank you so much. If you have not liked the video, please like the video, hit the like button and subscribe. I know there are so many new people that are watching and they are silent. They don't like talking. Just subscribe in silence. But one day tell us I'm watching. I always watch you from UK, the US, or somewhere else down there. It helps. So the people that are saying someone healed HIV, please come to the chat and tell us how it happened, which drugs used or which system this person used, and then we will discuss it. So cervical cancer is the topic, how to prevent it is the caption. Now, how do we prevent cervical cancer? How? Let me ask how. By doing what? Getting vaccinated. Children that are ladies that are 9 years old and above, get vaccinated on this HPV virus, so that when you get HPV, it does not destroy. Greetings, Marcia Thompson is here. Greetings, Marcia Thompson. Welcome to the platform. Welcome. Thank you for tuning in, and hit the like button. Everyone who is watching, you forgot, when you hit the like button, it gives an impression so that many people can come and watch. So I like friends, and you guys, you're my friends, and you love friendship, positive friendship. Let everyone come and we get more friends. Now, let's talk about, if you have not given your answer to the poll, give us your answer. I see some people have said yes, and then we will talk about it when we are ending. Now, practice safe sex, including condom use with which reduces HPV transmission. Yes, when you are having unprotected sex, you are risking your life to get HPV virus, which is linked a lot to cervical cancers. So that is very important. Protect yourself. Men, even men who you are married, and you are going out there with other ladies, unmarried ladies or married ladies, use protection, because you never know. HPV never says I'm HPV. This person never gets discharged. This guy, this person at early stages never gets burning sensation. So you will never know unless you test. So it's important, my guys, it's important that you use what? You use protection, so that you cannot bring it home. Avoid smoking, as smoking increases the risk of cervical cancer because of free radicals. The smoke gives you free radicals that destroy yourself. Imagine. Yes, the 17% of people who are saying they have seen someone who has been healed. Please come and give us a testimony. Please come and give us a testimony here. Tell us, yes, I saw this and this and they used this and this person got better. You know, it's a scourge. HIV is a scourge to the society. So we need people who can treat it. So we were talking and we have said we avoid smoking as it increases the risk of cervical cancer. Just imagine a stick, and then it produces free radicals. Free radicals tamper with breast cancer gene 1 and breast cancer gene 2. And then there is something called herceptin, human epithelial growth factor 2. And then you start having cancer of the cervix. You know, so anyone who smokes, raise your hand up, we talk to you. Anyone who smokes and you are not ending smoking recently, talk to me if you have it is hard for you to stop smoking. Seek medical evaluation for symptoms such as abdominal pain, vaginal bleeding, bleeding after sex, postcoital bleeding, or unusual discharge from down there. Seek guidance. There are some people after making love, they feel so painful and they bleed. Those are the signs of getting it. Painful, and then you start to bleed. It means that maybe the epithelial cells have started disintegrating, generating some. Today I've put on this one that is disturbing me. Some bad effects to the cervical area, to the cervical area. Preventing is very important. So those points, that I've said, first of all, vaccination against HPV, human papilloma virus, but brings cancer. Vaccinate yourself. Women, Stan's Kitchen, welcome. Stan's Kitchen, welcome. Thanks for tuning in. We are talking about how to prevent cervical cancer. We are talking about how to prevent cervical cancer. There are some points, 5 points that are very important before we go to the other points. Very important to women and to men too. Because men, you are the one who carries that without knowing, and you give to our lovely women. So let's go through the 5 important points before we go to the general one. And there is a poll running there. If you think you have an answer, please say yes or no. It's just a yes or no thing. So welcome, my friends. Welcome who is watching. Welcome everyone. Welcome and big up everyone who is watching. If you are new to the channel, tell us. Come to the channel and tell us I'm watching you from this and this place. And subscribe, man. Subscribe. We need more growth in the channel. We need more interaction. We need more interaction. So let's talk about the 5 important points. Let's talk about the first five important points. Wait a minute. I'll do this. Yes. Let's talk about the 5 important points. What are the 5 important points? Yes, one point is get vaccinated against human papilloma virus. Attend regular screening of cervical cancers. Yeah? You attend regular cervical screening. Yesterday we talked about pap smear and visual inspection with Lugol, iodine, and acetone. Practice safe sex, include condoms to people that you don't know. Avoid smoking, as smoking increases cervical cancer because of the free driving, but must support. Thank you, Stans. Seek medical evaluation for symptoms such as abdominal pain, abdominal vaginal spotting, bleeding and spotting, bleeding after sex, we call it post-coital bleeding, and unusual vaginal discharge. Now, there are some things that we should talk about, like general cancer prevention. Now, those ones, the first 5 were the most important one. If you have a question and you are listening to me, please don't fail to ask the question. Don't just listen, my friends. Let's get an interactive session. Let's get to an interactive session. If you have any question or you need to add on something, if you have a question or you want to add to something, please just do what? Just ask or add something. These things people have experience and they know how to prevent. They have dealt with someone who has always got a cancer, then they went through and walked through with this person in this journey of having cancer until this person got healed. So the experience may not even be practically medical, but those are the things we need to hear. So if you have an experience, you have something, bring it out, my friends. Bring it out. Let's talk. General cancer prevention. Don't smoke. It's general. Avoid tobacco products and second-hand smoke. Someone is smoking near you and you are still there seated. The person who is smoking plus you didn't understand the poll. Stan's Kitchen, the poll is saying, have you ever heard someone has been healed of HIV virus? Because I've heard several people saying that I am healed. So, some people said someone went to a doctor somewhere and this person got healed of HIV virus. So have you ever heard about it? Tell us if you have ever heard about it. Yes, that is the poll Stan's Kitchen. Now, as I continue, when flu gets to heal, you start having some sore throats that are very fine. Now, I was talking about passive smoking. You're just seated there and someone is smoking and you're there looking at that person as this person smokes. You don't tell this person, hey, stop smoking besides me. We are both smoking and I don't want cancer. Always stay away from people that are smoking near you. Send them away. Tell them to go to smoking areas. We don't want free radicals in our body. We want our body to be clean because our bodies are the temple of God. Yeah, the Bible says so. You see? Smoking is linked to cancer. Those times I said no, never. But times you see some people are saying they have. Yes, let's get to poll. Let's get the poll. Smoking is linked to cancers of the lung, mouth, throat, bladder, pancreas, and others, including cervical cancer. Just imagine. Lung, throat, bladder, pancreas, get stones. Hey, smoking and alcohol. Things that people do for pleasure. Imagine. Eat a healthy diet. Eat plenty of fruits and vegetables. Eat plenty of fruits and vegetables. Why am I saying people to eat plenty of fruits and vegetables? Because vegetables and fruits are antioxidants. They destroy the oxidative nature that can bring cancers. Antioxidants. So let's take more vegetables. Let's not say that I don't like vegetables. They are the key pillar of your health. Vitamins. And when I say vitamins, I don't mean you go to buy vitamins at the shop, at the pharmacies. Most people, when you tell them take more vitamins, what do? They go for synthetic vitamins. The pharmacy, they take vitamins. They are still vitamins, but the raw vitamins are the best vitamins, the raw ones. Just imagine you taking raw vitamins, feeling nice when you're taking some vegetables, some salad. Just imagine when you're taking some salad and you know it is getting into your body and you are deoxidizing. You people say that detoxing. Never say that word. Now the real deal is when you're taking your vegetables at the table, some salads here and water, and some starch here. You know, so the salads get to your body and the green tea, you know, and it destroys the oxidative state, so that when the blood, the nutrients get to the kidney, to the liver, they are converted into good things and your body is nurtured. And you know, vitamins are cofactors. When I mean cofactors, they help some factors in your body to bond and be tight. You have fish, chicken, vegetables, fruits. Stan's Kitchen. Yeah, now Stan's Kitchen has started salivating. Has started salivating. You see, I would say vitamins are cofactors. When you take them, what happens? Your gums becomes strong. Your tendons becomes strong. So bleeding from gums never be. You know. But when you start eating proteins from animals and you feel the junk food are good, more wheat, hey, my friend, start having beriberi, bleeding from the gums, low immunity, always antioxidants, oxidative state is high, you be prone to cancers, insulin resistance comes in because you have big stomach, bang, woman, city woman with a big belly. You have heard that story, that reggae tune. City woman with a big belly, a waistguard of 90 degrees, because you like junk and carbohydrates. And you know, carbohydrates are sweet, just like some foods that have cholesterol. When you go and take meat, you want to be given that has good bone marrow with some sweet fats. You know, when you eat, you feel good. And you know, they bring you to have what? Oxidative state. Cancers speak in. We are talking about how cancers and the adaptive, how to stop the cancer itself. Let's talk, my people. Let's talk. You know, when I'm talking, you are listening, asking questions and intervening. It becomes so fun, my friends. You know, the weekend was long and I was missing everyone. Stan's Kitchen, Sha Travels, Marcia Thompson, wow, J. Kingray, Jamaican Uncle Wase. Hey, I was missing you guys. Sometimes when I don't come live, I miss you guys, man. I miss you guys. I miss talking to you. I miss the interactions. You see, my friends are good people that support me. So let's be interactive. If you know how we can cure cancer, if you know, there is some people here have said they have had some people that have been cured HIV/AIDS. I wish this poll could show me these people. Let me see. How can a poll? No, that one is end poll. Can a poll who has voted yes. It can't. I wish I could see. Let's continue now. We have said smoking is a no. Eating healthy diet is the key point. Eat plenty of fruits and vegetables. The problem is, Uncle tells me every time here in the US, organic food is so expensive. But you have your backdrop there, backyard. Here in Kenya, I've seen some people are planting the vegetables in bags. In bags and containers. A very small area comes out with very many vegetables. Creativity, my friend. We want to stay healthy and it is expensive. What do? We become creative. The old worn out tires of your trucks, they cut them and they plant stacks. So you see vegetables are planted like this. Very creative. My friends, let's be creative in this one to stay away from cancer. That's why many people always in the US, in the other states that are urbanized, let me call them urbanized states, most of everything, they do what? They go to the supermarket, including vegetables. But you have a small backyard where you can stack your tiles with soil inside and do some good gardening. I think we should start doing gardening, artificial gardening. You know, prevention does not start from talking. I'm just saying, my friend. I'm not getting into someone now. I'm just saying, prevention starts from being creative and talking. And just like when we started a unit in the university that is called surgery, they told us surgery, the first thing you should do is to prevent. With prevention, we will not have patients in the theater always. So that is management. The surgeons, the doctors, instead of going to the theater to go and do some surgeries, we teach people to prevent. Imagine a surgeon going to the village telling people, you, boda, guys, you know, in Kenya, boda guys are those guys that drive motorcycle. You guys come here. This is a big surgeon that, surgeons in Kenya, I don't know, in Africa, they are totally respected. And the way they talk to people, even some of my friends. Meet me in theater in such a time. Then when you go to travel. Thank you, my sister, my big sis. When you go to clinical areas, the surgeon has a tie. Very serious face. Yes. Go to room number this. I'll meet you in theater 13th. That is not prevention. We should prevent at the primary level. You as a surgeon, you as a big name, go collect the people that are affected by this calamity. Tell them now, I don't want you to come later. I want to prevent this by these tips that I'm giving you. But now, if you prevent, where will their customers come from? Hey, my friends, are you feeling me? Hope someone is feeling me, Are you feeling me? Are you getting to my... Now let's help people to prevent from getting the cancer. Let's get people to prevent from getting the cancer so that we cannot be having people on what? Radiotherapy lines. Having people on chemotherapy line. The drugs are so expensive. Some people go home to do what? To get fundraisers. Funds. Imagine. So you don't smoke. Stop smoking. I don't want to get you on chemotherapy line telling me this bill is so expensive. Please stop smoking. Avoid smoking. At that backyard that you are having at your home, the small backyard that you are having, get plastic containers, get your worn up tires of your trucks, put soils inside in stacks, plant vegetables on those. I'm being creative. Oh my goodness. Oh my goodness. I'm trying to be creative because someone will say, Doctor, you're saying me to plant vegetables. Where will I plant? At that small backyard that you have, organic food can come from there. Tomatoes, vegetables. Do stacks of containers. Get old rags, bags. They are called sacks. Sacks are good. Get some soil on the sacks. Get some soil on the sacks. Do some vegetables. Now, your land is small, but you are getting creative going up. Vegetables. Now, choose whole grains and high fiber foods. Whole grains and high fiber foods. We know high fiber foods. I'm just talking to the people, my friend. I'm brainstorming and I'm being passionate on it. I'm being passionate on people to avoid getting into chemotherapies and radiotherapies. Just imagine your doctor is being passionate of helping, but the laziness and lack of knowledge has made us to go in a bad way. You see, Sha Travels is giving me gold medals. My sister understands me so well. Yes, Jamaican uncle listening. Stan's kitchen driving while smiling. Stan's kitchen. I know where you are driving, you are smiling and listening. Sometimes when I talk, you smile. Marcia Thompson, welcome. I know you are listening. Marcia from Jamaica, you see. All these guys here, these people, the supporters, they are smiling because avoiding is better than treating. Preventing and avoiding is better than treating. And I may say it jokingly and demonstrating it in a funny way. But these things that I'm saying, they are saving lives. Whatever I'm saying is saving lives. For you eating more of carbohydrates and getting junk foods on your table because they are sweet, what happens next? Fine refined foods, canned foods, what do they do? You start becoming big. People tell you nowadays you are healthy and you are tired of you are using lifts every time while people are using stairs. What do I need to say again? What do you think I need to say? What do I need to say, my friends? What do I need to say? Let's continue. Limit processed foods, meats, and excessive red meat. Excessive red meat brings more creatinine in your body, and even your kidney suffers a lot. So if your kidney suffers a lot, what do you think will happen to your cell? Excretion, removal of dirty things in your body reduces. Reducing dirty things, the kidney is the mother of cleaning your body. And the liver is the father of turning that into something that is not toxic. It turns it to something that is not dirty, and then it leaves the blood to absorb the others, and the bad things are taken to the portal, drainage to the kidney, and then the kidney washes and reabsorption happens and you remove urine. Just imagine. So we take care of our liver by taking, we take care of our liver by taking some good things like what? Purpose, nutritious that helps the liver to bring back something called P53, tumor necrotic factors, cytokines of immunity. Your liver becomes strong. Good hepatocytes. Hepatocytes are liver cells that make the continuous detoxing of bad things to neutralized to good and then we continue having a healthy body. The only organ in your body and the only thing that does detoxing is the liver. That is the work of the liver. Detoxing is neutralizing harmful substances into substances that are not harmful. You feel me, guys? You feel me? Yes, if you're feeling me, say yes, man. Don't just listen. Come on, come through and tell me to the chat, Dr. Ben, we are feeling you. We are feeling you, and we want to kick cancers out of the world because, we are all the world here listening. Yes? Let's continue, my friends. Let's continue here. Maintain healthy weight. Big weight is equal to insulin resistance. Insulin resistance comes with a sister called diabetes. Hey, diabetes comes with another brother called hypertension. Then you come with another thing that is the mother of all, that is called heart failure. My friend, stroke is knocking. What is the best food that we can eat to build our liver? Hey, uncle, hepatocytes. Liver cells are called hepatocytes. The cells of the liver. The cells of the liver. Maje, I know today you are enjoying. My presentation is fine. Today you are feeling it. And I'm feeling this when I'm talking to you. I'm feeling nice when I'm giving this information. I'm feeling good. I'm empowering you to kick cancer out of the world. Uncle has asked a question. Uncle, at your backyard, at the backyard of your place, the backyard of your place, do a good garden, a very good garden. Plant there some spinach, some kale, kales, skuma wiki are called collard greens, and cabbage. Get some plants. Cuties, hello everyone. This is Cutie Jesse, just subbed, bro. Hey, Cutie, Cutie Jesse. Your name is kind of like Cute Jesse. Welcome, cuties. Jesse, just subbed, bro. Thanks a lot. Now, I was answering Jamaican uncle. Today, I'm being guys. When I was in high school and even college, I was a drama, I was acting. So I'm kind of like giving the expression of kicking out cancer in a dramatic way. So today I'm joining drama and the talk so that people can understand me well. So my friends, I was answering Jamaican uncle. And I've said, Jamaican uncle, please, at your backyard, at your home, let's do an orchard. Plant some apple trees. Eat some oranges, antioxidants, a lot of vitamin C. Get, you feel me, guys. You get how I'm expressing it. I'm expressing it like this because these things are antioxidants. They kick out oxidative states of the cells and the cell cannot mutate. The DNA becomes strong. Just imagine. Just imagine. So avocados, good cholesterol. Protein-rich foods, fish, skinless chicken, good. Here we call it kuku. In Kenya we call it kuku. In my mother tongue we call it ingoho. Share travels. Where you are, please say kuku. But with no skin. Lentils and eggs. So nice. Protein-rich foods. Healthy food fats. Healthy fats. Let's eat healthy fats. Seeds, olive oils, and avocados. Whole grains, oats, brown rice, and whole wheat products. Don't do a lot of whole wheat. You know, your body will become big. And why not skin of the chicken? Because it contains cholesterol, and that's why it is very sweet. It contains cholesterol, and that's why it is very sweet. Just imagine the most important thing that you need to have in your backyard garden. Spinach, kale, sukuma wiki, cabbage, broccolis, cauliflowers, apples, oranges. Please, 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 my friends, don't say that you don't have land. Your backyard is small, you cannot cultivate. It's only for flowers. Flowers are good for seeing and proposing to your lady or giving someone that has. But for health purposes, the green leafy vegetables that you see, they are smiling at you. They are saying, hey, please cook us. Cook us. We will remove the oxidative state of your cells and your DNA will become strong. Your hepatocytes, the cells of the liver, will become so strong. Take this as a poem. Today I'm demonstrating as a poem so that you can feel it. You can come to my, you can feel what I'm giving you. I want you to be having good life. I want you to feel nice inside when you're taking those vegetables, knowing that you are kicking cancer out of the world. We don't want cancer in the world. Can you say amen? Yes. The doctor was an actor one day. So that is a part of detoxing the liver, Dr. Benjamin. Very important. When you're taking vegetables and they are antioxidants, they are oxidizing even the liver cells. The liver cells are part of your body. So you do good to all the liver cells. You see? You get? So let's continue. We're still continuing with prevention. I was just answering Jamaican uncle. And if you're feeling me and you're feeling the vibe flow, you do what? Come at the church. Tell us, doctor, I'm feeling the vibe. Please, how can I do this? Can you say yes, Ben, man? Can you tell me yes, Ben? If you're feeling the vibe, you say yes, Ben. Doctor, we are feeling the vibe. We want to kick cancer out of the world. If you're feeling this tune, if you're feeling this vibe, can I hear you say, yes, Ben? Can I hear you say, yes, doctor? Very important. I'm very passionate when it comes to matters concerning destroying cancers, destroying HIV, destroying something that is coming to destroy the human body. And one day, Doc, we should eat less food that contain carbohydrates. Very true. Yes, Margie. Eat carbohydrates at a limited level because, more sugars in the body are converted into cholesterol if you are taking more. Where will they go? More vitamins, less carbohydrates, and some proteins. Good nutrition. Yes, Margie. Yes, we continue, my friend. Today is so emotional. You know, when you are having a talk that is helping people to stay away from something that is destroying some people, you feel good. You feel like, yes, this is the information that people need. This is the information that people want to have. Yeah, we are continuing, my friends. We are continuing and we are feeling nice. Are you feeling nice? Are you watching as you feel nice? Yes. Tell me if you're watching and you're feeling nice. Because the doctor today is so passionate and is taking green tea as he's talking. Green tea contains antioxidants. Feeling good. Staying away from cancer. You know. Stay physically active. Aim for at least 150 minutes of moderate exercise per week. When was the last time you said, today I'm gonna walk? I'm gonna walk from this set to this set. I will go to my garden. I'll exercise. If I don't have a garden, if you have a garden, if you have your workers at home, one day join them. As they are working and you are working with them, you are motivating them and you are exercising yourself. You have a house manager and 2 workers in your big mansion, and usually what these workers do work. Yes, uncle is just coming back from working. These house managers you have, they wake up at 3 a.m. to make sure your mansion is spotless clean. Your house is spotless clean. You never join them. One of them is cleaning that house from top to bottom, from corner to corner. Very tired. By the time it is coming to 8 a.m., the back wants to drop down to the ground. Have you ever joined these workers while they are doing that job? For exercise, give them motivation. Wake up at 5, clean it with them. You are doing an exercise. Fiona is in the house. You have washing machines. Join them. Carry those clothes to where the washing machines are. Exercise. Sweat. Release those. Mr. Benjamin, HIV virus is a virus, has no cure. Good, Fiona. You see, even Fiona knows. Say yes or no. You see that? Yeah? Join them. Our late Prime Minister used to go and join some workers, chat with them, It is healthy stepping down on the ground outside gardening. No matter how much, I'm back, I am sorry. Welcome, Alicia. No matter how much money you have, your health is important, right? Don't live sedentary lifestyle thinking you have made it. It is of good gesture to your body, not just to go to the gym because you can't do the gardening and the house chores. You have to pay the gym so that you exercise, or walk because you don't want to do house chores. House chores are good exercise and gardening. Look at Jamaican uncle. If you have not followed Jamaican uncle, follow. See how Jamaican uncle does his things. Your health is better than your money you have in your bank. Stop using it wrongly by buying bad food, by paying for exercise that you never go. You go to the gym to sit down and look at others. Am I getting into someone's nerves today? No, I'm not. I'm just giving some good advice. Give me a break. I take some green tea. Listen, green tea. I'm breaking down some oxidative states with my green tea to make my body to be stay away from cancer. Let me get a sip. Green tea, antioxidant. Feel nice. As we continue, if you have a question today, bring it to the chat. If you are a new person, subscribe to the channel. My friends are good people. My big sister Sha Travels is here. Very nice person. Jamaican uncle J. Kingre, Fiona standing as a lawyer, Alicia Bausia always here, and cute Jessie plus Marjay from Jamaica. You see, we have Marcia Thompson always listening and supporting. Our new friends in the chat, welcome. Big up Onik. Onik has been here. So we are just talking. That was about exercise. And you see how it is flowing? It is flowing so nice. Hey, the music is flowing. And everyone in the dance hall, listening and doing work. That's nice. Hey, it reminds me of Leroy, who sang, and if a man can buy a juice, he must go drink his water. Yeah, physical exercise. Limit alcohol. If you drink alcohol, do it in moderation or avoid it altogether. You drink and sorry about that. Yay, my brother Smiler in the city. I was watching Smiler while he was driving in the streets of the Queensland. Smiler, I usually come when your premieres are ending. I don't know why. Smiler, welcome to the platform. We are talking about avoiding cancers, avoiding cancer and other things. And today I'm doing it as a poem. You take even Charlie Black. Charlie Black says, that song of Charlie Black. You know, when I'm singing, sometimes I relate these factors. Shot 1, shot 2, shot 3, shot 4. After some minutes, she come back for more. Then she talk up like a so. Then she approached me just like a cure. You know, they still love me. You know, alcohol. Because you did not, Charlie Black say she had not taken alcohol. But after taking 1, 2, 3, and 4, she gets the courage. Your nerve system has broken down. Now you have to, the girl gets the courage to broke out like a so. Then she approached me that like a so. No, so she said, you know. So alcohol gets away from your own character and destroys you medically by making you having fatty liver because of the process of breaking it down. Fatty liver. Fatty liver means your hepatocytes are dying. Then some few times coming, you'll start having liver failure. Liver failure goes up to liver cancer. Today we are talking about cancer and how to avoid cancers. Smile in the city. Welcome. Jamaican uncle here just from walking. Cute Jessie and Fiona, the lady studying as a lawyer, is in the house. Don't forget Marcia Thompson and my big sister Sha Travels listening silently while the funny doctor is giving a poem about avoiding cancers. Good. So alcohol. Limit alcohol. Protect yourself from infections. HPV, sexually transmitted disease. Like which one? Syphilis, gonorrhea. Very important. And the other thing, comes in. Urinary tract infections. Stop it, man. Have sexual health. Don't be that man is gully baby. No, don't be a gully. Protect yourself from insanity of the society. Protect yourself from the insanities of the society. Stay cool. Why is it called fatty liver? Is it because the liver gets fat, Dr. Benjamin? Because I had it in my early years. It is called fatty livers because the cholesterols that are being controlled, the carbohydrates that are being burned, turned to cholesterols, are deposited in the liver, the fats. So when there are so many, they make your hepatocytes not to work well, your liver cells not to work well. That is why it is called fatty liver. Mbika Kwagwira. Greetings, Dr. Benson. Greetings, Mbika Kwagwira. Mbikwa, please subscribe to the channel and give a like button. Where are you coming from, Mbikwa Kwagwira? Are you from Rwanda? Mbika Kwagwira, are you from Rwanda? Let people be loyal to their partners. Yes. Be loyal to your partner and treat your partner well. You don't expect someone to be loyal for so long and you are treating that partner as trash. No. Treat your person with loyalty and respect. Respect the relationship by making that person smile, making that person feel that she is the best thing ever happened. Reason to the relationship. Reason, my friends. Reason, my friends. You know, insanity comes from Mbika Kwagwira from Bosnia, doctor. So Mbika Kwagwira, you are my first friend from Bosnia. Subscribe to the channel and give me more people from Bosnia, because I love having friends all over the world and different places. In a slang language here in Kenya, we say na mashimo mingi, different places, slang language. So have you liked the chat? Have you liked the talk? Don't give cheating partner. If your partner cheats, sit down, ask your partner, why did you cheat? Or you will end up going to another cheating partner. Solve it, hit that person, give that person some strokes and make that person understand cheating is bad. Out here, everyone, many people are fools. If you have stayed with a person for 20 years and he cheats once, reason with that person. What happened? If it is unavoidable, that is where you call it quits. But if it is something that you can talk, you just don't let 20, 30 years go like that. Out here, people, wolves, you know, that song that sings, I live among the creatures of the night, vampires, hypocrites, and parasites. So your person could be a victim of creatures of the night, vampires, hypocrites, and parasites. And he falls into the net. By the time this person realizes that I was a victim of vampires, the deal is already done. So, my friend, cheating, sometimes you get to understand the situation. I love what you do very much. I make sure I watch all of your videos, even if I don't get into your live sessions. Thanks, Mbika Kwagwira. Please, thanks. I hope you are sharing to many people. We should grow. Thanks for coming in. Thanks. Guys, I told you people watch these videos after we have come live. You see, Mbika is saying even if he's not in the chat, he comes back. But today, he has made it. Thanks, Mbika Kwagwira from Bosnia. Give us more people and your friends from Bosnia. We need more friends from Bosnia. What do you think, my friends? Protect your skin. Avoid excessive sun exposure. Use sunscreens and protect clothing. You know family history of cancers. If you have family history of cancers, talk to your doctor. Your doctor will explain you what to do so that you cannot expose yourself. So what are the early signs to check? A lump that does not go away, unexplained weight loss, persistent bleeding, changes in bowel habits, a chronic cough, a mole that changes in size, shape, and or color. So friends, sorry, I made a mistake with this time setting on my video because I just realized it starts at 11 a.m. It starts at 11 a.m. You can change anchor. Let me see. You will confuse our people. We'll be waiting at 7 here and you have, oh, it has started. Sorry about that. As I finish, I'm just about to finish. So, my good friends who are watching and everyone watching, those are ways to protect yourself from getting these problems. I've put a poll here that says, have you ever heard of someone healed of HIV? And the poll says 17% says yes, and 83% says no. So the no have won. But in reality, can someone get healed of HIV? There is no cure of HIV as per now. That is wrong. So if you said yes, a person can be healed of HIV, you will come and tell us how that person got healed of HIV. Don't feel shy and to come and tell us. If you used some magic, some juju, some green vegetables somewhere, please come and tell us you used it. Thank you so much for viewing, and let me say, anyone who has a question, please. Is there anyone? I'm giving 7 minutes to answer any question that a person has. Anyone who has a question, if you have a question, you can text it there so that we can help. You know, question says that you want to understand that thing so much, so well. So anyone who has a question, 7 minutes to go. 7 minutes to go. Let's get to see. Anyone with a question before I log out? Anyone with a question? I'm just waiting for any question I have. That's 6 minutes to go before we close the session of today. We have talked about how to control general talk on how to control someone not to get cancer. But there is at night, I'll talk about 3 hours from now, I'll talk about Jamaican uncle. You are having a premiere now. The time changed. Savior man, it was a mistake. He did put the wrong time. But no worries. So anyone who has a question is Savior man, you are here. Do you have any question? Do you have any questions, Savior Man? Any question? I have 5 minutes to go and no one is asking me any question. So that is what I was saying. I want to talk about the people that have, oh, Leila, you are here, long time. And nowadays, hustle has made us not to meet so much. At night, I want to talk about something. I want to talk about an important thing at night. Those families that have, there are families that are Savior Man from London, UK. Blessings. Yes, welcome. Multitasking between channels. No worries. I'm just about to finish. Now, I'm saying how many minutes? I have 4 minutes to go. I'm saying tonight I'll be talking about something that is very important. And doctor, can masturbation cause cancer? Yeah. Savior Man, Mbika is making me laugh. Mbika is making me laugh. Savior Man, help me answer that. Can masturbation cause cancer? In men or in women or in general? In men or in women or in general? Masturbation cannot cause cancer. In men, in fact, you are helping that prostate to work so much, you know. But in women, it's a problem because of infections. But it cannot cause cancer. Now, maybe it can make you can for a woman can masturbate, get an infection because of dirty hands and tools. You know, tools of masturbation, yes? And then you start having chronic infections that can end up getting you to cancer. But in men, no. In men, it's rare. So someone told me when you masturbate a lot, you are helping your prostate to be constricting every time. So when it is constricting every time, you have less chances of getting prostate cancer. Just listen to that. But you know, masturbation is not good. It can lead you to have mental breakdown. So if someone is masturbating, stop masturbating. Find someone who can work for you. Okay, Mbikwa, that is my answer on that. 3 minutes to go. Anyone with any question, even if it is a good question like Mbikwa's question. So Mbikwa, no, it cannot cause masturbation. The problem with masturbation is mental challenges, mentality, mental challenges. I like that question. Very open and direct question. It makes people to understand. Yes. How many minutes to go? 2 minutes. Anyone with any question before I drop down tonight? But I'm coming tonight. I'm coming tonight with a topic that is important. How you can how you can prevent yourself getting cancer when you are genetic line you have cancers. You know, there are some families that have cancers, and you are prone, you are at risk to get it. So how can you prevent? That is the topic of the night, including cervical cancer. So anyone with any question? Who has any question, my friends? 1 minute to go. 1 minute to go before I bring it down to closing session up tonight. So if you have any question, you have 1 minute to go. 1 minute to go. And the poll is closed at, let me see the Our poll is closed at 86% saying no and 14% saying yes. So the no have it. Many people have never heard of curing of HIV. So those that have said yes, please come and tell us how you heard about it. So I'm ending the poll at that. Now, okay, now you guys stay cool. I'm coming at 9 with that topic. Those people have cancer in their genetic line, their family. How can you prevent? So bye. See you after 3 hours. 6, 7, 8, 9. 3 hours. Bye bye.